Reproductive choices for queer and trans youth matter. Here's a glimpse of what we want you to know. Queer and trans youth have diverse families. Providers should be inclusive in family planning discussions, acknowledge that there are various paths to parenthood, and be considerate of chosen family. Respecting a person's gender identity is critical. Even in discussions about reproduction, it's important to utilize a person's affirmed gender identity, name, and pronouns when delivering care. Many folks may experience reproductive health trauma. It's important providers practice trauma-informed care to create a supportive environment and understand past experiences. Queer and trans youth want care that is inclusive, affirming, and supportive. Be allies in their journey. Understand, respect, and empower their choices for a healthier, more inclusive future.
Today, I'm going to be sharing my perspective relating to transgender reproductive health. As a transgender individual myself, I understand how intimidating, dysphoric, and alienating reproductive and sexual health discussions can be. When I turned 21, I should have started going for pap smears. I attempted it once, but the experience was uncomfortable. The physician assumed I was a woman, told me it was normal for women to be uncomfortable, and I left before the exam began. What I wish healthcare providers knew is how affirming and reassuring it is to be supported by the provider themselves. It's not just about broad-level statements, it's about recognizing the unique and individualized experiences within the trans community. So what's your role as providers? First, recognize the diversity within the trans experience. Use affirming language and avoid assumptions. Validate the feelings of transgender individuals, and create a safe and comfortable space for discussions. As service providers, you play a crucial role in making a positive impact on transgender individuals' reproductive health.
I wish healthcare providers understood the importance of compassion and conducted their work through an understanding of the complexity of the human experience. Training on queer healthcare needs, using respectful language, and acknowledging diversity are key. Being open-minded, willing to learn, and providing non-judgmental care can make a world of a difference in the well-being of queer and trans folks.
I remember that nervousness, the excitement, the anxiety, just that built-up tension to making that first phone call to accessing healthcare. I want to say that that first point of contact sometimes is the most important. So I want to thank, first of all, those folks working at the desk answering those calls, and encourage those folks there to continue or start to lead with gentleness and compassion when caring for the healthcare of queer and trans folks. Continue asking questions or getting clarifications. Be open to pronouns and preferred names. Check in with folks in where they need your support. I know for me that some of the thing that's allowed me to access healthcare in an affirming way has been those positive responses and the people who are there willing to say, hey, how can I help you? And exclusively saying that I want to show up for queer and trans healthcare. So continue to gift knowledge to those folks, or if you're folks sitting behind the desk, know that your impact is really, really big. So thank you for picking up that phone and saying, hey, how can I help you?
Hi, my name is Anjali, and I'm in the Community Advisory Committee at YouthCo, and I was asked to answer 2 questions. 1, what do you wish service providers knew about sexual and reproductive health care for queer and trans people? And 2, what do you wish you knew sooner about queer and trans sexual and reproductive health? I think with the first one, what I wish service providers knew, I wish service providers knew how significant trauma-informed care is. I think in dealing with queer and trans people, the majority of folks I know have dealt with a significant mental health problem, and I think in recognizing the hurdles many queer and trans folks have had to overcome, I think being open to hearing their stories and empathizing with them is a better way to understand the care they need and just provide the care they need. Also understanding that it's not a one-size-fits-all, even though the heteronormativity of the healthcare system is terrible, and service providers are often educated on just the heteronormative side of sexual and reproductive health. Not only do I think that service workers should be educated in queer and trans health, but also understanding that it's not a one size fits all. It should be an open dialogue of what they feel like they need, and showing them the support that they have, what they can ask for, and also open a dialogue of what they would like and what they would want, and just be open and take the time to really understand them. I think just in recognizing that and feeling, I don't know if people realize how important it is to feel understood and seen, and for service providers to do that is power for the people who are receiving care. And I think it is a significant thing to acknowledge in terms of just providing care for folks, especially with intersectional identities. It just makes it all the more important. In terms of what I wish I knew sooner about queer and trans sexual reproductive health, I think I just wish I knew that there was community to support you. I think that there are peers and youth and folks that are there to support you and won't judge you. And community is it's a really good feeling, and it's something that very much is an asset in terms of having to go through sexual and reproductive health care issues, because it's just like-minded individuals also being able to explore what they need. And I think I wish I knew about, there's this book that actually Youth Co provided for me. It's called Pleasure Activism by Adrienne Marie Brown, The Politics of Feeling Good. This book is, I think it's actually a really big game changer. I wish I knew about it sooner because I feel like it's such a good thing to know, to read. It centers queer folk. I think we are so often left out of the conversation to be having conversations with other queer and trans folks, or being able to have conversations with service providers. It is a new power dynamic that has often been neglected for us, and I think this is like a really good start. And there's also another series that I really wish I knew about and have found out is it's a Netflix series called The Principles of Pleasure, and it very much discusses that intersectionality aspect of, it's like sex education if sex education also included everyone, which you would think is the bare minimum, but it's not. And I hope that like these changes that this committee it provides, then that this should be the norm, that we should be included in these conversations, and that it is power, that we are reclaiming it and acknowledging what it is we need. So yeah.